Bismillahirrahmanirrahim. Dear students, in this lecture we will be discussing the second part of the anti-inflammatory drugs, and we will be focusing on the steroids and glucocorticoids. So in this lecture, you will be able to identify the classes of glucocorticoids, recognize the glucocorticoids agent and their indications, the feature and differences of glucocorticoids drugs, the mechanisms, therapeutic effect, and side effect of these drugs. Here we will discuss a little about the steroids and different form of steroids and their physiological processes. So steroids are normally occurring compounds and hormones that act as chemical messengers. They stimulate the biological responses in different tissues like reproductive physiology, sex differentiation, maintenance of salt and sugar metabolism, stress and behavioral changes. So these steroids play an important role in all these processes. Um, in the classes of steroids, we have different classes like sex hormone, androgen, estrogen, progesterones. These are different types or classes of steroids. Vitamin D and its derivative bile acid. Here we will focus only on the glucocorticoids and mineralocorticoids. So glucocorticoids do have anti-inflammatory actions, and we will be focusing mainly on this glucocorticoids for its anti. So steroids are synthesized from the cholesterols, and they are produced in the adrenal glands, testes, ovaries, and livers to be transported in the bloodstream by plasma transport proteins. So mainly they are transported in the form of attached proteins. Some are formed in the free form, so only the free form of the steroids is active. You might recall this from your pharmacodynamic lectures that only those drugs are active which are free in the plasma. Protein bound drugs, they are normally inactive, and they cannot be distributed into or eliminated from the body. So basically, hypothalamus, whenever we have in response to stress or any condition, stressful conditions, the hypothalamus releases corticotropin releasing hormones, which initiate the adrenal glands to produce the adrenocorticotropic hormones, and then adrenocorticotropic hormones causes the release of cortisols from the adrenal gland. So cortisol is basically produced by the adrenal glands with the help of adrenocorticotropic hormone, and this is the main determinant in the production of cortisol. So as we have discussed, free steroids are hormonally active form, and its concentration determines the activity. The active or the bound form is not active. It is regulated by the rate of steroid biosynthesis and rate of catabolism. So this depends upon the rate of how much is synthesized and how much is catabolized and excreted. They are after metabolism, these compounds or these steroids become hydrophilic and can be excreted through the kidney. But in the normal form, they are hydrophobic or lipophilic. So you might remember from your pharmacokinetics, the only hydrophilic compounds can be excreted through the kidney, while lipophilic can be reabsorbed into the blood. So the purpose of metabolism is mainly the formation of lipophilic compounds or metabolites. We have different types of steroid agents: cortisol, hydrocortisones. This is the natural steroids, while these are the synthetic form of steroids. So you might have seen that synthetic steroids have less side effects, more anti-inflammatory effect, and longer half-life than natural steroids. So this is the anti-inflammatory effects. You can see it is increasing, and dexamethasone has the highest or the most efficacious anti-inflammatory drug. well, it doesn't have a more sodium retention activity, and the half-life is very much higher as compared to the other form of steroids. So you don't have to memorize these numbers. We normally don't ask for this, but you have to know which one has the highest efficacy or potency, and which have the shortest efficacy, potency, or the duration or half-life. Now the mechanism of steroids, it has anti-inflammatory action and immunosuppressive action. Anti-inflammatory action, if you recall from the NSAIDs, NSAIDs inhibit the cyclooxygenase enzyme here, while the steroids, they inhibit the phospholipase A2 enzyme here and inhibit the conversion of prostaglandins into arachidonic acid. So it has more anti-inflammatory action as compared to NSAID, and it is inhibiting more mediators. So along with that, it can decreases the activity and production of histamines, decreases the leukotrienes pathway as well, which is not inhibited by the cyclooxygenase. So it is inhibiting all these leukotrienes, cytokines, decrease proliferations of blood vessels, decrease activity and production of histamine release. So all these mediators are decreased by or inhibited by the glucocorticoids or steroids. So that's why it has anti-inflammatory actions and immunosuppression, because these mediators are excreted in response to immune or hypersensitivity reaction. So normally these drugs are used for their anti-inflammatory actions and to decrease the immune system in case of organ transplant or those patients who have autoimmune disorders. So important steroids in this class are the glucocorticoids and mineralocorticoids. So as you can see from the name gluco, so it stimulates the gluconeogenesis formation of glucose, and that's why the side effects will be hyperglycemia, especially in those patients who have diabetes. While mineralocorticoids, you can see from the name mineral, so it can increase the reabsorption of sodium and water into the blood and increase the excretion of potassium. So it can lead to the increase in blood volume by retention of sodium and water in the blood, and can lead to hypertension. Along with that, it can inhibit the glucose uptake into the muscles and adipose tissue. That's why it can lead to muscle wasting and fats redistribution. So normally the central obesity is there, but the other body parts are become weaker. It can stimulate the adipose tissues breakdown, anti-inflammatory and immunosuppressive actions that can be therapeutically used in different conditions. So the consequences of long-term use of glucocorticoids leads to diabetes, because you have seen it increases the gluconeogenesis, so it can increase the glucose level in the blood. Or long-term use can lead to Cushing syndrome, in which the hydrocortisone level increases. That increased level of hydrocortisones leads to fat redistribution, muscle wasting, and it can lead to central obesity, osteoporosis. All these are the side effects of glucocorticoids. Hypertension is the side effect of the mineralocorticoids, because it can lead to retention of sodium and water within the blood, and that increases the blood volume. Indication, therapeutic uses, it can reduce the inflammation. That's why it can be used in the bronchial asthma and rheumatoid arthritis. So arthritis, because of its inflammation, it's very effective in the asthma, but it should be used topically or in the inhaler form, not in the systemic form. We will discuss this in detail in the anti-asthmatic drugs. It can suppress the immune response, because it has the immunosuppressive response. So that's why it can be used in diseases like SLE, which is an autoimmune disease. And in this disease, the body's immune system mistakenly attacks the healthy tissue. So and normally this can also be used in case of organ transplantation in order to inhibit the immune response to the organs that has been transplanted into the body. Nausea and vomiting, it can reduce the nausea and vomiting. That can be induced during the chemotherapeutic agent, so that's why it is used as an adjunct therapy in the chemotherapeutic agents. Addison disease is the opposite of Cushing syndrome, where we have less amount of adrenocorticotropic, where we have less amount of adrenocorticotropic hormone. So it can be used for the replacement therapy in those individuals who cannot synthesize the endogenous adrenocorticotropic hormones. The side effects of corticosteroid therapy include the diabetes mellitus, that is because of the formation of glucose or gluconeogenesis, and mineralocorticoids can lead to hypertension because of the accumulation of sodium in water within the body. Along with that, corticosteroid therapy inhibits the absorption of calcium from the GIT. It can also impair the synthesis of sex hormones. That's why it can lead to weakness of the bone or osteoporosis. And that's why it should be supplemented. These patients should be given calcium or vitamin D in order to decrease the osteoporosis. Along with that, it can also lead to that fat redistribution, Cushing syndrome, adrenal suppression, especially long-term use of these corticosteroids can lead to adrenal suppressions and menstrual irregularities. Other side effects include the infection because it can decrease the immune response, emotional disturbances, cataract or glaucoma are less common. However, GIT bleeding because of the inhibition of thromboxane A2, that's why it can have that anticoagulant effect. These drug has like all other drugs, it has to be withdrawn slowly and or stopped slowly and gradually. It should not be stopped at once because it can rebound. It can have rebound actions, like it can increase the intraocular pressure and it can lead to glaucoma when suddenly stopped it. And Addison disease, because if you are taking exogenous corticosteroids, that leads to the adrenal suppression, and adrenal suppressions lead to this Cushing syndrome. So Cushing disease is a kind of disease where you have less amount of corticosteroids or adrenal glands inappropriately synthesize corticosteroids. So this is all about the corticosteroids. This is the general symptoms that are associated with the corticosteroid use: buffalo face, hypertension, thinning of the skin. It's a classic example of Cushing syndrome. Osteoporosis, tendency to hyperglycemia, a negative iron nitrogen balance. All these are the side effects of the corticosteroids. Increased bleeding, etc. So these are very effective drugs, but it has a lot of side effects. That's why these drug has to be used with caution. So avoid the misuse. Very careful about the selection of the drugs. Like it can different kind of drug, and the short courses, use the short courses. Daily doses is preferable. Taper chronic steroids slowly. If you have used it for long term, then taper down it slowly and gradually. Does topical steroid cause the same side effects? So of course, that's why it depends on the agent selection and the use, whether do you need systemic or the topical administration of steroids. So this is all about the corticosteroids. If you have any questions, you can write to me anytime. Thank you.